everybody. Coach Anna here, and today I am speaking with Dr. Doug Kosmicki. He's an interventional cardiologist who practices medicine with my husband, and he also has a really incredible story, and some of you who live in this area of Nebraska probably know that he ran in the New York City Marathon as a type 1 diabetic because it was in the newspaper, it was on the news, it was on the Lincoln News. So anyway, I'm just going to hand it over to Doug for a minute while he tells us a little bit about his story.
Yeah, so I would start with just, diabetes has affected my entire life. My father had type 1. He was diagnosed as a child, and I think he was 11 or 12 when he was diagnosed, and then ended up with every complication, underwent 2 kidney transplants, was blind, had a leg amputation, and then ultimately passed away at age 32 from complications after his second kidney transplant. And so I was 12 at the time, and I kind of made it through, my teenage years and 20s, and really thought I was probably safe from getting diabetes, at least type 1 diabetes. And then at the age of 44 in 2018, I wasn't feeling very well, and over just a few weeks, figured out that my blood sugar was extremely high. My A1C was around 10.4, so it was an average blood sugar of 280. I was extremely dehydrated and just did not feel well. So I quickly, we were suspicious of it being type 1. I didn't fit the typical profile of type 2, and so quickly was started on insulin, and things quickly, or I should say gradually, improved over 6 months or so after that. So one of the so type 1 and type 2 that we're talking about, they've kind of divided it, and they call there's also type 1.5 or LADA, but I think to make it simple, there's really 2 types. There's type 1 and type 2. Type 2 is what most people have. It's over 95% of diabetics, and it's an insulin resistance syndrome, and it is where insulin levels are very high. The body cannot use the insulin to get the glucose into the cells, and so that's most people, and that's a lot of some of it's inherited, a lot of it's lifestyle and nutrition, as Anna has focuses on a lot. The other, type 1 is an autoimmune process. It's where you quit producing insulin or don't produce enough insulin, and your body has antibodies that attack the beta cells in your pancreas, and the pancreas.
And the beta cells are what produce insulin.
Yes, they produce the insulin, and so your blood sugars run high because you don't have enough insulin, and so they've kind of developed this, I think it's called latent autoimmune diabetes of adults, or type 1.5, which is basically type 1. It's an autoimmune process. It just occurs later on as people, if someone's diagnosed, I guess I'm not even sure what exact age they consider it, but
Right.
Certainly at my age in the 40s, they would consider it more the LADA type of.
And you've also got the type 1 diabetics who have had an injury to their pancreas, or an acute pancreatitis or something like that, where their beta cells.
Yes.
That has nothing to do with autoimmunity, but they just don't produce insulin anymore.
Yes, that is another nuance, and that's that's certainly much less common, but more commonly, the kids in their late, early teens, late teens, early 20s are the quote unquote typical diagnosis. However, as they learn more and do more testing, they realize that it can present at any age as an autoimmune process.
So we're both big fans of Dr. Bernstein, who wrote The Diabetes Solution. And he talks about, and you have talked about it, the law of low numbers. Can you explain that?
Yeah, so so Dr. Bernstein's an incredible gentleman. He's in his 80s, has had diabetes for over 70 years, probably the longest living type 1 diabetic, or longest living for the time that he's had the type 1, essentially his entire life. I think he was diagnosed around age 10 or 11, but he figured out basically on his own that eating a very low carbohydrate diet allowed him to maintain normal blood sugars. And so he focuses on a higher protein, low carbohydrate diet. And what he talks about, the law of low numbers, is so the problem with everything is it's estimates. So when they put food labels on, their estimates, and they only have to be within 20%. So if you eat something with, say, 10 grams of carbs, and so a common insulin to carb ratio would be a 1 to 10. So you inject 1 unit for 10 carbs, and so if the meal, if it has 8 carbs or 12 carbs, it's not going to be that big a difference, but that could be, I mean, your meal could only have 8 carbs, or it could have 12, but if you're just injecting 1 unit or 1.5 units, your error is going to be much smaller. So as opposed to if you are, say you eat a meal, which would not be uncommon with 100 carbs,
It's not uncommon
at all. You could be at 80 carbs, or you could be at 120 carbs. And so then you're trying to match up, your insulin. So you're taking 10 units of insulin, which each unit of insulin would, a lot of people, it'll drop them up, 40 points or so. Everybody's a little different and they have to kind of figure out their own, but, an average would be 40 points. So you're talking huge variations in what their blood sugar could do. I mean, if it was truly 80 carbs and they're injecting that much more, their glucose can drop dangerously low.
Right.
And then,
and this goes for any diabetic, not just a type 1 diabetic.
yes. I mean, anybody that's on insulin.
So insulin is a serious natural hormone that our body produces if we're lucky, and there's a very homeostasis kind of thing that goes on. Our blood can only handle so much sugar. So if we don't know how much sugar is in there and our regulation is broken and we're taking exogenous insulin, that's where we can get into some trouble.
Yeah, there's some pretty scary statistics on, just the injecting insulin. There's not too many diseases that they send you home with a medicine that is that dangerous if you don't dose it properly.
And so ideally you want to take as little exogenous insulin as you possibly can to maintain your normal blood sugars.
Yes, I mean, I think that, insulin has lots of complications as far as weight gain and things like that. So, I mean, you want to take as little insulin as possible to maintain normal blood sugars. Obviously,
so this is an energy storage hormone, basically, guys. This is, insulin is meant to transport energy into your body, and especially like your muscles and your heart and your, all of your tissues, but then it also gets stored for later use, in case of emergency, which never happens nowadays, where we would have run out of food and we could use our stored body fat for energy. So that's the purpose of insulin. But it also, you said, helps with growth. And I think this is a good time to start maybe talking about what do you do? It's more complicated with a small child that has type 1 diabetes because they need to grow. So does the law of low numbers apply to them, or do they need to eat more frequent meals in order to grow? If they were what would you do if you had a child, say, that was like 7 years old and was diagnosed with type 1 diabetes, how would you approach their meals?
Yeah, I mean, I would say that certainly I am no expert, and this isn't medical advice what to do yourself or to your child, but I would work with your provider. But I think that there is a group on Facebook called Type 1 Grit, and they have over, I think it's 3,500 or 4,000 members. And a lot of them are parents of type 1 kids, and they're following basically Dr. Bernstein's program of a very low carbohydrate, high protein diet. They will use, I don't know how many, but a lot of them still use injections as opposed to an insulin pump.
Right.
And they will use a long-acting insulin, and then they'll use, most commonly we use regular insulin when you're eating a low carbohydrate diet, because it kind of goes along with the low numbers thing, is that your protein, when you're eating a higher protein, that will turn to glucose also through gluconeogenesis. And so, but it's a much slower process. And so regular insulin covers that slow increase in blood sugar better than the new rapid acting insulins. So,
right, because you're not getting a bolus of, when you're eating low carb and high protein, you're not getting a bolus of glucose going into your bloodstream.
yes.
And interestingly, I mean, gluconeogenesis is really an on-demand driven process. So that just means to make new glucose. And so eating sugar, carbohydrates, is absolutely unnecessary for human life. We could all live if we never had a drop of any kind of carbohydrate in our body ever again. We might feel like we're going to die if we've been eating a lot of it for a long time, but we won't, and it's just interesting how amazing this system is, our bodies, and how it can really, take care of itself largely. So that's really interesting to know. So
getting back to these kids, so they show pictures, of these kids. They're growing, they're playing basketball. There's kids, playing high school basketball, competing at very high levels athletically, with a very low carbohydrate diet. So, I think that there's no evidence. You don't need carbohydrates to grow properly, or to function normally. And so I think these kids are thriving. The other group, so I mean, if you ask me what would I do, I would be part of this type 1 grit. I mean, they have every recipe that's low carb. I mean, these kids are still eating, low carb cake. They have for special birthdays. They have, you can come up with all kinds of.
I make a chocolate pudding from Craig and Maria Emmerich out of hard-boiled eggs that you would think was a Hunt's snack pack for Lisa. And I'm telling you, the Emmerichs, they raise their kids almost just about as close to carnivore as you can get. Extremely low carb, 20 grams or less of carbs a day. And those kids are right where they're supposed to be on the growth chart. So I would recommend Craig and Maria Emmerich's cookbooks as well, because their cookbooks are literally precisely, she's an RA, or she's a registered dietitian, or RD, and she's just amazing. I'm actually trained through her for my keto coaching. But you had mentioned A1C, and I just want to talk about hemoglobin A1C, because that's glycation that you're measuring, and glycation is the sugar coating of that hemoglobin, right? That's what you're measuring, and that hemoglobin's been around for about 3 months before it goes away, and that's why we check it for a 3-month period. We can look back and see how much glycation has been happening in the body. So why should we be concerned about glycation and diabetes?
Yeah, I mean, you have, two big categories of complications that you worry about. One is the microvascular complications. So with diabetes, that's if you do not control your blood sugars, we know that neuropathy is increased. That's nerve damage. So the glycosylated glucose damages the nerves. you have retinopathy, so it affects the eyes. It's leading cause of blindness. And then you have nephropathy, the kidney failure. So those are the big the microvascular complications. Then you have the macrovascular complications. So you worry about heart attacks, strokes, are the two big cardiovascular and peripheral vascular disease. So
what this does is it hardens all these tissues, right? So they don't function the way they should.
yeah.
So I heard an endocrinologist once when I was a nurse and I was at some continuing education, and he talked about it. It's like if you take a sugar donut, a nice fluffy one, it has the perfect amount of sugar. Our cells are supposed to have glucose. They all have some glucose in them, and this is just the right amount. But what if you dipped that donut in that sugary syrup again and then let it harden? Now it's not as soft and pliable and fluffy, and then you keep re-dipping it, and that's essentially what glycation is doing to your cells, right? So this is where you get the diabetic foot ulcers. You get your eyes are getting like brittle, like your cells are not gonna work, and you lose your vision, and all these complications are easily avoided, aren't they?
Yes, they are. And I mean, the thing that's, they can definitely be significantly reduced. And so, the thing that's frustrating or that I see, so, everybody worries about heart attacks and cholesterol. And so when you start diving into the actual data, and it's always bothered me. I mean, as an interventional cardiologist, we see people come in and most of them have normal or low cholesterols that are having heart attacks.
Right.
But the thing that is always consistent is insulin resistance. So their A1Cs will typically be just a little bit high. And so, someone that quote unquote is not diabetic, but their A1C is 6.4, that's not normal. And
Right.
so they have a significant increased risk of a heart attack. And so we know that at a level of, so the ADA recommends a level of less than 7.
Right.
But we know at 7, your risk of a heart attack is 5 to 6 times higher than if your A1C is 5.5 or normal, 5.5 or lower.
And isn't it even true that even once you get up past 5.1, all causes of mortality go up sequentially with each point?
Yeah, it kind of varies. I mean, I think, I haven't seen anything that, if you're under 5.5, I have not seen anything where, I mean, it starts to maybe increase just
you're just
splitting hairs. Once it gets above 5.5, I mean, it does increase. I mean, it's a dramatic, 5 to 6 times higher risk by the time you get to 7. Which 7 is essentially twice normal blood. I mean, that's an average blood sugar of 150 or more. And so it's essentially twice normal.
Right. And that's scary, really. But before I forget, I guess I wanted to ask about these kids on this site. So I'm sure they're still all prepared and have a glucose on the type 1 grit. The parents of these kids, they're probably always prepared for a low blood sugar, which you need to be with anybody that's a type 1. So they probably have glucose tabs or whatever with them. But do they experience, because I know people that have diabetic type 1 kids, and they're in and out of the hospital up and down with the blood sugars. Some of them have a dog to sniff whether their kid is in trouble, with their blood sugars. So
yeah, no, it's amazing. They will show, the graphs. And so I think that most kids probably have a continuous glucose monitor. And so you get a nice graph of what your blood sugar does, and you can, average like a week, or you can do a month or 3 months or whatever. And it'll show, I mean, they will vary between, 75 and 120 or so. And they try to keep, Dr. Bernstein says a normal blood sugar is 83. So they try to keep it at that level, but they'll have graphs, pre-Bernstein or pre-low carb diet and post, and it just smooths everything out.
Wow.
And so, I think it's, it's just so or it's really sad that, more people don't know about this, that they can't. I can't think of anything more stressful than, injecting your kid with this medicine and then having them go low or having them go too high. And because you quickly find out you're trying to match up two spikes, carbs and insulin, and it is very difficult. I mean, it just, either the insulin hits too soon and you go low and then you spike up later, or you don't, or you take too much, the insulin hits first and you drop down and then you have to eat and then you spike up later on. And so it's really hard. And I mean, I don't think, and as a parent, I mean, you wouldn't realize that. I mean, these kids are trying to go to school, and if your blood sugar drops 100 points, if it goes from 300 to 200 or 300 to 100, which would still be normal, you feel bad. I mean, it does not, you don't feel good at all. And when your blood sugar is at 300, you don't feel well either. And so expecting a kid to, try to take tests and concentrate in the classroom, I think would just be, would be very difficult. And so
it's like riding a roller coaster, and that's not how our blood sugar is supposed to be. Like, if this is normal, this is what's happening to these kids, and how can you feel good, when it's supposed to be more like this?
Yeah. So I think that one argument, I mean, it's going to be tough, as raising kids. I mean, you can't control them as a parent. I think my goal would be to give them the tools that they know this is available, that they can maintain normal blood sugars, because they're going to mess up. I mean, you teach them hopefully to not, that they, do not go low, that you can, how to treat that and stuff. But, they're not going to be perfect. But I think empowering them and getting them to the point that they realize how good they feel,
right,
their blood sugar is normal, that it will become part of their life as they become, teenagers, go off to college and young adults.
Yes, and that's where, like a resource like Craig and Maria Emmerich and her website, she has recipes for ice cream that my 16-year-old daughter, her boyfriend thinks that the strawberry cheesecake ice cream that I make, that's like hard, it's practically no carbs. I mean, it might have like 3 carbs for a big serving, and you can't even eat the whole serving. It's so rich. You can actually make better treats for your kids that the other kids will want to come to your house and eat them, that are super low carb, that can keep this law of low numbers going for you. And so I don't think people should give up. And I think, it's a battle worth fighting, because we're talking about the long-term health of your child. And Dr. Bernstein's book is a great read, and I think really helps you get inside of somebody's head and what it was like to, he experienced a lot of neuropathy and things before he figured this out. And his story is interesting and fantastic, and we really don't have that much time to go into it today. But I also wanted to talk about hyperinsulinemia, and I couldn't find Dr. Bernstein's book, but I do have Dr. Joseph Kraft's book here. And Dr. Kraft, he talks about hyperinsulinemia. That's what he thinks diabetes is. And he is, I mean, I think it's the truth. I think that he's right about that when and this is type 2 diabetes now, not type 1. So of course you're not going to have hyperinsulinemia when you can't produce insulin. But this means your insulin is really high. And so when we get hangry, that's our insulin has, overshot our blood glucose, and now we're below baseline and we're shaky and we're hungry and this and that. We're not even a diabetic. We don't have a high A1C. We don't have, high blood sugars because the insulin's doing the job, but we're already getting damage from that kind of eating pattern and lifestyle, aren't we?
Yeah, you can definitely, I mean, that's the problem with kind of a pre-diabetes diagnosis is, I mean, I tell patients it's being kind of pregnant. I was like, you either have diabetes or you don't. I mean, when they're pre-diabetic, they sometimes have this reassurance that, oh, it's not that bad. Well, it is. I mean, you develop the same complications long term as if you're diabetic. And so unless they make changes, but their insulin levels are quite high. So one of the, I think that in medicine, we're not really ever trained. We never check like fasting insulin levels. I think mostly because, we don't have a medicine that, I mean, honestly, what doctors are trained to do is to diagnose and give a medicine. We're not really trained to diagnose and then have someone change their lifestyle. That's why we have health coaches, but
well,
I think that
medicine's coming around a little
they
bit.
are.
I think and there's some doctors that specialize in de-prescribing now. Yes. And literally, this is what you're on. Here's how we're going to get you off of these medications. And I don't de-prescribe anyone, but I work with people and I say, go to your doctor, let them know this is what I'm doing. But this is why too, when we're talking, there's the information that we give to people in our society when they have diabetes is eat less, move more, calories in, calories out. And that's based on a calorie is a calorie thinking. And so if you tell me, that 100 grams of ground beef is worth the same amount as 100 grams of pure cane sugar, and those two things don't react differently in your body, I'm going to tell you you're crazy. But we tell people that all the time, right? Oh, you can have sugar in moderation. Oh, you can, just push yourself away from the table. Just do this and do that. And sugar is a psychoactive drug. If you ask me, I specialize in food addiction, and it reacts on your dopamine. And it's really hard to take like one bite of a piece of chocolate or something and not eat the whole candy bar. That's a difficult thing to ask people to do. But by switching to a low carb diet, you can then, you can mimic some of those rewards and treats if you want to, and you can get rid of that toxic chemical that sugar is. It's not just an empty calorie, it's a toxin. That's why insulin raises up so high, because we were never meant to eat it in the quantities that we eat it now. So that's something that I think is confusing and difficult for people when they get a diagnosis. Well, I'm doing what the doctor said. I'm eating what the dietitian eats, but I can't do it because I'm starving. Well, they really do feel like they're starving because they're eating super low calorie all the time. And they're just, they're not eating enough nutrient density, where if you switch over to a lower carb diet, you can eat more calories because they don't have the same effect on your body. So you don't feel like you're starving, and it's more sustainable, I think. So what do you think about, do you see that changing down the road? Do you see any movement in our community with, I know that a lot of doctors are handing out Dr. Fung's book,
Yes, I definitely do. I mean, I see lots of changes that are occurring. And so, it's a lot of the primary care providers are learning about this. They're recommending it. I think, it's something new, and so it'll take time, but I think with, continued community education, I think ultimately, I think, trying to do stuff locally in your own community is going to help. I think long-term, we really need the nutritional guidelines to change, because, we send these, we send people to the nursing home and they worsen. Patients go into the hospital, and the food, I hate to say it, it's processed food that is not healthy. I mean, people's A1Cs go up. Typically, I mean, it would be unusual if they didn't. And so I really think, long term, to make really big changes, like across, large populations, you really need the nutritional guidelines to change.
The Diabetes Association, I know, has changed some of what they say about low carbohydrate eating as an option for diabetics. And so that's definitely a move in the right direction. But I have to tell you, I wrote to our senator about the diet, you know, and I got a call back, and they told me that I needed to bring proof about, you know, why the dietary guidelines should change. Bring us proof, because they said they were science-based. And I said, well, prove it. Show me the science that says, based on a 2,000 calorie diet, that 60% of my calories should be from carbohydrates. And the representative from our senator's office was just stumped. But the truth is, there is no evidence for the diet that they're telling us to eat. And it is the agricultural department that has made up these guidelines. It's not based on science at all, but people think it is.
Yeah, it's really not. I mean, it was, you know, when the food pyramid came out, it was, we were, as a society, people were not eating that many. They were eating about 40% carbs. And then when they recommended low fat, the only way they could recommend that was to increase carbs up to 60. And as you can, you know, everybody has the graphs that show, you know, obesity and type 2 diabetes and everything just
it all
escalating. Yeah, just escalating since they've recommended that. And so it really, and along with that, I mean, all the, you know, the processed foods, I mean, even if someone, you know, I think for what I, you know, tell my kids that are healthy and people that, I mean, if you're in your 20s and you're completely healthy, I mean, I think, you know, eating whole foods is going to be your best bet. I wouldn't even, I mean, but, you know, eating fruit is fine. I don't think it's going to cause problems for someone that's healthy, and eating a natural fruit they're not going to run into problems. They're, you know, eating meat, fish, chicken, non-starchy vegetables. You know, I think that's overall, I think if you have metabolic issues and other autoimmune processes, you do need to be stricter and maybe eliminate those things. I mean, I eat a little bit of berries, but I don't eat much fruit at all. So I'm amazed at how many people bananas have become, I mean, everybody wants to eat just bananas all the time. Like,
well, and bananas used to be like, you know, this big historically, and now they're like this, and they are a sugar bomb, you know. But I do also, just for our last little bit of time, I want to talk about type 1 diabetics and type 2 diabetes together, which I have seen in my practice as a health coach. A type 1 diabetic who has gained weight, and they're packing it on, and they keep increasing the amount of insulin they use. And so they've kind of created their own hyperinsulinemia through what they're putting in their mouth and what they need to do. You know, so they end up with, you know, non-alcoholic fatty liver disease, or as I like to call it, high fructose fatty liver disease, you know, and they end up with, you know, all of these other things, a high hemoglobin A1C, all of these things that we were talking about.
So certainly double diabetes is a huge issue in the type 1 community, which it only makes sense when you have, you know, if you look at the statistics, 88% of Americans are metabolically unhealthy. So, you know, that only makes sense that someone with type 1 diabetes, as they follow the standard American way, that they're going to become insulin resistant, and they're just going to have to continue to take more and more insulin, which begets more insulin resistance. And so it's a huge issue. I mean, there's actually kids now being diagnosed with type 2 that have hyperinsulinemia. And so that's, you know, the biggest growing, I think you've quoted that with the obesity, you know.
10% of kids now have fatty liver disease. And for people that don't understand this, I was a nurse at the VA, and some of these old vets with their alcoholic fatty liver disease, it is a miserable disease, and it's the exact same disease. Alcohol is just distilled sugar. It's just sugar. That's all it is. And actually, high fructose corn syrup is more damaging to the liver faster than alcohol is. And that's, something that people don't really want to talk about. Oh, don't tell me that. I want my candy. I want my treats. Really? You're walking around and you're seeing these kids with big bellies, and it's central obesity that is the telltale sign of metabolic syndrome and diabetes, isn't it?
Yes. Yeah.
So, I mean, it's very serious to have fatty liver disease. And this wasn't even a diagnosis until the 1990s, correct? It didn't even exist until after we got our first food pyramid as a diagnosis.
Yeah, I mean, I've seen it's the leading cause of liver transplants now is fatty liver disease, leading cause of liver failure. So it's a very serious. I mean,
and how they fatten up goose liver for goose liver pate, foie gras, or however you say it in French. They feed these geese, they force feed them corn, and corn is very high in fructose. So this is where we get, high fructose corn syrup. And so they know that what you're putting in the mouth of this goose is causing this fatty liver to occur. And that's the same thing we're doing with our kids when we decide, oh, well, fine, I'll get you some treats. I'll get you Cheetos. I'll get you Takis, ice cream, soda pop, all of these things. And our kids are literally, their brains are getting hijacked. I've seen research where children's brains are smaller, not just from what they're eating now, but also from social media and not, just not thinking the way we thought. Our brains are shrinking since the advent of agriculture. And now kids' brains are shrinking like dramatically by ounces. And that's frightening to me. So I'm on a mission, and I know Doug is too, to help people take back their health, because you can take back your health one bite at a time. If you're type 1 diabetic, yes, you're gonna have to take insulin. So what? You don't have to have foot ulcers. You don't have to have heart disease, at least not by something you're putting in your mouth. And I don't know, I'm going to make sure that I attach the books names to this video, so you all will be able to read the books if you like. And Dr. Bernstein is still practicing, isn't he? And
yeah, I don't know. I mean, I know he's still practicing. I don't know if he does like full, all the time, but he still practices. He does, YouTube videos.
Yeah.
I don't know if they're weekly or every other, but he does those frequently. He's, he's still very active in his mid 80s. I mean, it's amazing. So if he's
he does a free Facebook Live or something like that, or YouTube thing. He does it free for any doctors and any parents with type 1 diabetics, or any diabetic can go to his little talks for free, and he's easy to find. And like I said, his story is phenomenal. He was the first person that ever tested their own blood sugar at home regularly, and that's a story in and of itself. It's just kind of like history, and I'm kind of a nerd, so I like that. And so one final thing, how important is vitamin D to a type 1 diabetic, or for that,
Yeah, I think overall, I guess I'm not totally, I think that, vitamin D is very important. I think that probably the best is getting sunshine. I mean, you need to, I think there's several aspects. You need to, get outside and exercise every day, get some sunshine. You need to sleep well at night, and you need to do some stress reduction things. I mean, all of those affect you. I mean, so nutrition is obviously a big part of it, but if you have a ton of stress and you're not eating or not sleeping at night, your health is going to be severely affected. I think the sunlight helps with vitamin D. I think here in Nebraska, obviously during the winter, I do think that you probably need a little extra vitamin D. There's debate as to how efficacious that is, taking supplements, but but it might be worthwhile, talking to your doctor, knowing what your level is.
Right.
Um,
Well, and, and even talking about sleep directly affects appetite. And the research shows that someone who sleeps under 6 hours a night will eat 300 to 500 more calories than a person that sleeps over 6 hours per night. And that's a drastic change in energy. Just because calories in, calories out doesn't work, because a calorie isn't a calorie, doesn't mean that if you overeat calories, that's okay, that's not gonna help you even if you're on keto. You can't just eat and eat and eat and think that your body's gonna have to store that energy somewhere. So I think that's another interesting thing too that can help you control your blood sugars and your life and everything. And anyway, thank you so much. I hope you'll come back again and maybe talk about, maybe there will be some new things to talk about with diabetes and with type 1. And I know things have changed so much with being able to have continuous glucose monitors and insulin pumps. And it's really gotten a lot better for people with type 1 diabetes. And I really believe that things are going to come around, because there's so many of you out there that are changing what you're doing, and your doctors are seeing it and they're seeing the evidence.
I think that, all the technology is great, but it just reinforces how important nutrition is, because despite all this, only 17% of kids achieve A1C goals and only 21% of adults, which is just, not good. I mean, it tells you that despite all this knowledge and all these things, insulin pumps and everything else, that nutrition is still just so vitally important. So the other thing I would like to, the other group that is Let Me Be 83. So this is a organization out of Sioux Falls, South Dakota, a family up there that started this. And so it's, they follow the Bernstein method also. And they have a young child, and lots of pictures, and he blogs, and he's very good, someone to follow, kind of inspiration, I think, for a lot of these people. And so, it's amazing as you get into this area, some people, I mean, I've been doing this for a couple of years, and people say, well, it's not, I think medical professionals, nurses, diabetes educators, general public will say, well, it's not sustainable. But as you're in this community, you start to realize that you meet people that have been doing this for 20, 30 years. I mean, Dr. Bernstein's been doing it way longer than that. And so, I think it's really, it's sustainable. It's something that, it's really just asking yourself to eat real food.
Yes. Yes.
And so, I think it is something that's sustainable, and you can maintain normal blood sugars. And it's liberating to know that you don't have to worry about feeling bad because you're spiking high, or that you're going low all the time. It allows you to, live more freely, honestly. I mean,
yes. I have to agree. I mean, for me, it's for other autoimmune diseases, and autoimmune diseases love to buddy up. I know that type 1 diabetics are tested frequently for celiac disease now. So, to mitigate, like, once you have one autoimmune disease, if you start eating real food right away, maybe you won't express more bad DNA, but that's really great. That sounds like a great group. And is that a website, or is that
Facebook and website?
Okay.
Yeah, there's a Facebook group and a website. So,
and really, I mean, the outlook for someone who's diagnosed with type 1 diabetes based on the standard treatment and not doing low carb, what is the longevity? What's the life expectancy for someone after a diagnosis with type 1 diabetes on average?
I mean, you don't want to scare people, but it's not good. If you're diagnosed as a child, you know, there's data showing your life expectancy of 15 to 20 years shorter. And so with standard care. So, I mean, I think that if that isn't motivation enough to, you know, to make changes. So.
And I'm sure your father would have made changes had he known, you know, I'm sure he would have wanted to be here, you know, watching you help
Oh,
and
yeah.
heal people and seeing his grandsons. And, you know, that's what it's all about, enjoying all those small moments with people. And we get the opportunity to do that a lot longer when we take care of ourselves. So thank you so much, Doug. Your story's amazing. And your generosity is amazing. I have to tell you guys that this man has taken me around to every doctor's office except for Kearney doctor's offices. I've been here, I've been in Hastings with him, and just trying to get the word out to people that there's a different way to heal, and that, you know, doctors want to help you, but they don't have all the time that a coach has. And I give you guys all the information you need, but if you need a coach, you know where I'm at. So thank you, Doug.
Thanks, Anna.